Hello everyone, welcome back to our Fine Nursing Tutorial YouTube channel. In this class, we are going to discuss types of IV fluids. Who all have visited first time on this channel, please do subscribe and watch. We'll see what are all the types of IV fluids. Here, full form of IV fluid is intravenous fluid, which is directly injected in veins. Here, NS normal saline, DNS dextrose normal saline, RL that is Ringer's lactate solution, and then D5, D10, D25 solutions, and then Mennitol solution. These are the types. We'll see one by one. We'll discuss it in detail. First one is NS, normal saline. Here composition 0.9% NaCl, that is sodium chloride. That is 100 ml bottle. 100 ml bottle and then 500 ml bottle. And then uses. Here it is very important. Normal saline is used for. It is used in the condition dehydration, wound washing, dilution of injection, and then maintain water balance. Keep it in mind. And then dose of normal saline is completely depend on patient condition in disease. Dosage is always depend upon the patient condition. And then 2000 to 3000 ml in 24 hours. Okay, next we'll see next IV fluid is DNS, dextrose normal saline. Here composition 0.9% NaCl plus 5 gram dextrose, 500 ml bottle. And then it is used for dehydration, hypertension, to treat insulin shock in accidental condition. And then dosage is quantity of dextrose normal saline is depend on patient condition and disease. Here also same. It's depend upon the condition of patient, and then 2500 to 3000 ml in 24 hours. This is the dosage. We'll see the next IV fluid, that is RL, Ringer's lactate. Composition, it is mixture of electrolyte in which present sodium chloride, potassium chloride, sodium lactate. Here composition is that we can see in the mixture of these three, that is sodium chloride, potassium chloride and sodium lactate. And then here uses are, it is used for dehydration, electrolyte imbalance during the surgery, and then burning condition, nutritional deficiency in case of hypotension, and it is suitable for diabetic patient also. And then dose of RL is depend on patient condition and disease, and then here 500 to 1000 ml in that is 24 hours in a day. And then next IV fluid is dextrose. Here composition we can see D5, that is 5 gram dextrose in 100 ml. And then D10 is 10 gram dextrose in 100 ml. And then D25 is 25 gram dextrose in 100 ml. And then it is used for dehydration, weakness, and also in the case of dizziness. Dosage is 2000 to 3000 ml in 24 hours. Next one is mannitol solution. You can see in the picture mannitol solution. This is the type of diuretic solution. It means it increases the volume of urine. It's a diuretic. And then composition is that 20 gram mannitol in 100 ml. And then uses for, here we can see the uses, very important. Reduction of intracranial pressure, reduction of intraocular pressure, treatment of acute kidney injury, and then promotion of toxin excretion. These are the uses of mannitol solutions. This is all about the IV fluids and uses. I hope you all are very clear with the topic. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.